Stroke is a leading cause of long-term disability worldwide, often leaving survivors with challenges in movement, thinking, and daily activities. Rehabilitation is a crucial part of recovery, aiming to help people regain as much independence as possible. Over the years, traditional therapy methods have been the mainstay, but new technologies are emerging. One of the most promising is virtual reality, which offers an interactive and engaging way for patients to practice important skills. In this video, we'll explore the latest evidence on virtual reality for stroke rehabilitation, based on a comprehensive Cochrane review. Virtual reality, or VR, is a computer-based technology that creates simulated environments. These environments can mimic real-life objects and events, allowing users to interact naturally. In stroke rehabilitation, VR programs are designed to help patients practice movements and activities that are difficult to replicate in a clinic. Some VR systems are immersive, using headsets to place users inside a virtual world, while others are non-immersive, using screens and sensors. The goal is to make therapy more motivating and accessible. After a stroke, many people struggle with movement, especially in their arms and hands. Traditional therapy can be repetitive and sometimes limited by resources or environment. VR offers a unique advantage. It can simulate real-world activities, provide instant feedback, and keep patients engaged for longer periods. This increased motivation and practice time may lead to better outcomes. Additionally, VR can be tailored to individual needs, making it a flexible tool in rehabilitation. The Cochrane Review analyzed 190 randomized trials involving over 7,000 stroke survivors. These studies compared VR-based therapy with traditional therapy or no therapy at all. The main focus was on upper limb function, but other outcomes like walking speed, balance, cognitive function, and quality of life were also considered. The review included both immersive and non-immersive VR applications, reflecting the wide variety of programs available in research and clinical practice. Researchers searched multiple databases and trial registries up to September 2023. Only randomized trials with adult stroke survivors were included. The studies compared VR with either alternative therapy or usual care. Importantly, studies that only compared different types of VR without a control group were excluded. The team assessed the risk of bias and used meta-analysis to combine results, ensuring a rigorous and systematic approach. The review included a diverse group of stroke survivors, with most studies recruiting adults at various stages of recovery. The majority of studies were small, with only a few enrolling more than 50 participants. This diversity helps ensure that the findings are relevant to a wide range of people recovering from stroke, though the small size of many studies means results should be interpreted with some caution. VR programs tested in these studies varied widely. Some were simple, game-based applications that encouraged movement through fun challenges, while others were more sophisticated, immersive systems designed specifically for rehabilitation. Most aimed to improve arm function or mobility, such as walking speed and balance. Only a small number of studies used fully immersive VR with headsets, highlighting an area for future research. The most important outcome was upper limb function, how well people could use their arms and hands after stroke. Other key outcomes included mobility, like walking speed and balance, cognitive function, activity limitation, participation in daily life, quality of life, and any adverse events. By looking at a range of outcomes, the review provides a comprehensive picture of how VR might help stroke survivors. In comparing VR to alternative therapy approaches, the review found that VR may offer slight improvements in upper limb function and activity. The evidence suggests a small but positive effect, meaning that patients using VR might regain more use of their arms than those using traditional therapy alone. However, the certainty of this evidence is low, so while the results are promising, more high-quality research is needed. The review also looked at balance, a critical factor for independence after stroke. VR may be slightly better than alternative therapy in improving balance, with a small positive effect seen in the studies. This could help stroke survivors feel more confident and stable when moving around. Again, the certainty of the evidence is low, but the trend is encouraging for those considering VR as part of their rehabilitation. Activity limitation refers to difficulties in performing everyday tasks. The review found that VR probably reduces activity limitation compared to alternative therapy. This means that people using VR might find it easier to carry out daily activities, such as dressing or cooking. The evidence here is of moderate certainty, suggesting a real benefit for incorporating VR into rehabilitation programs. Mobility, including walking speed, is another important goal in stroke rehabilitation. The review found that VR may have little to no effect on gait speed compared to alternative therapy. The evidence here is very uncertain, so it's unclear whether VR can help people walk faster or more efficiently. This highlights the need for more research focused specifically on mobility outcomes. Quality of life and participation in daily activities are crucial for stroke survivors. The review found that VR may have little to no effect on these outcomes compared to alternative therapy. While VR can be engaging and motivating, the evidence does not show a clear improvement in overall quality of life or participation. This suggests that, while VR may help with specific functions, its broader impact is still uncertain. One interesting finding is that adding VR to usual care, essentially increasing the total amount of therapy, probably leads to greater improvements in upper limb function and activity. This suggests that VR can be a valuable supplement to traditional rehabilitation, especially when it encourages patients to spend more time practicing. The evidence here is of moderate certainty, supporting the use of VR as an adjunct to standard care. When VR is added to usual care, there's also evidence of benefits for balance and activity limitation. Patients may experience better balance and find it easier to perform daily tasks. These improvements can make a real difference in independence and confidence. However, as with other outcomes, the certainty of the evidence varies and more high-quality studies are needed. Safety is always a concern with new therapies. In the studies reviewed, a small number of people using VR reported mild side effects, such as pain, headaches, or feeling faint or dizzy. Importantly, no serious adverse events were reported. This suggests that VR is generally safe for stroke rehabilitation, but as with any therapy, it's important to monitor for unwanted effects. While the number of studies on VR for stroke rehabilitation has grown, many are small and not of high quality. Some studies did not report on all outcomes of interest, and the risk of bias was often unclear. As a result, our confidence in the evidence ranges from moderate to very low. This means that while the findings are promising, they should be interpreted with caution. The evidence presented in this review is current up to September 2023. This means it reflects the latest research available at the time of publication. As technology and research methods continue to evolve, future updates may provide even clearer answers about the role of VR in stroke rehabilitation. In summary, virtual reality may offer slight benefits over traditional therapy for improving arm function, balance, and activity limitation after stroke. The greatest benefits appear when VR is used in addition to usual care, increasing the total amount of therapy. However, the effects on walking speed, quality of life, and participation are less clear. VR is generally safe, with only mild side effects reported. More high-quality research is needed to confirm these findings. Looking ahead, researchers are interested in exploring more immersive VR applications, such as those using headsets, and in conducting larger, higher-quality studies. There is also a need to understand which patients benefit most from VR and how to best integrate it into rehabilitation programs. As technology advances, VR may become an even more important tool for helping stroke survivors regain independence. Virtual reality is an exciting and evolving area in stroke rehabilitation. While the current evidence suggests some benefits, especially for arm function and activity limitation, more research is needed to fully understand its potential. For now, VR can be considered a useful addition to traditional therapy, offering a safe and engaging way to support recovery. As always, rehabilitation should be tailored to each individual's needs, and new technologies like VR offer promising options for the future.